Dr. Omar, when someone comes into your clinic and you're looking at the pattern of acne on their face, does that direct you to prescribe them an Accutane or spironolactone for the best and most effective results?
The patterns of acne that we are taught classically and that we see, we've mentioned, and Danielle's also mentioned, is when you get these cystic breakouts on the cheeks, the chin, the lower face. We consider that sort of the beard area, deeper hair follicles, but also might also have more sensitive receptors, like hormone receptors. We think that's more classic hormonal acne. And so we would recommend, so that's when and if it's a female patient, I would recommend spironolactone as a starter, and I would give it at least 8 weeks. And if it doesn't do anything, then I would escalate to isotretinoin. But another sort of pattern of acne that we hadn't touched on, and what they're calling on social media, is this like fungal acne,
Mm.
or it's not really a fungus; it's more of a yeast. That's where you see all these fine little bumps on the like. Patients don't always notice it
It's
themselves.
the ones you can't even really
You
pop,
can't
right?
pop.
Yeah.
They're underneath the skin.
Mhm.
We call it monomorphic. They're all look the same, and they're usually on the forehead. We used to call that pomade acne, or like acne from your pore cloggers in your hair products, which that still plays a factor. But also, we've seen more and more that it's a yeast that lives on the scalp, the same yeast that causes dandruff actually causes acne on the forehead. So you see that, and you have to treat that very specifically
Mhm.
because it won't respond to retinol, it won't respond to Accutane either.
It's really important to identify the different types of acne so people aren't roguely going on different prescriptions dealing with the side effects when it's not even helping it in the first place
Yeah,
because it's the wrong type of acne.
yeah.
Vandalic acid works for fungal acne. It's one of the few things that works. That's why we chose it for our lineup.
Dr. Omar, who are some of the groups of people that you see struggling the most with acne? Just some examples: athletes, makeup artists, teens, new moms.
In Chicago, so I practice downtown Chicago, so I have a very specific patient base. They're younger, usually new moms, or patients that are trying to conceive, reproductive potential, hormones still very much active, whether it's an imbalance of estrogen or imbalance of testosterone. A lot of my patients, like I mentioned, are trying to conceive, and unfortunately, like a lot of the things out there are not indicated when you're trying to conceive or when you're pregnant. Chicago has a very robust theater scene, so believe it or not, I see a lot of stage actors that have to wear makeup, 8, 10 hours a day, regardless of what they do. It's part of their job. And athletes. And when you see athletes, their acne is usually in a specific pattern, and you want to ask about supplements and things like that. But usually, younger athletes, stage actors, young women, to be moms to be, or new moms. These are sort of the patients that I see.
That's so interesting because for some people who are dealing with acne for the first time as maybe a slightly more adult, a young adult, maybe they never dealt with it as a teenager. It's important to note that there's different triggering events that can bring on acne for the first time. So, for new moms example, I had a friend the other day, she's in her mid 30s. She has never dealt with acne in her entire life, and she's on her second child and breastfeeding. And the breastfeeding for her just really activated acne all over again because sometimes it can hormonally mimic where you were as a teen. You're like producing so many hormones the same way you are as a teen. And so I had to walk her through the pore clogging checker, get on a routine because she never had to care about a routine at all and never had to look at those things. So just a reminder that you may have never dealt with acne before, but there may be a triggering event where you now have to look at pore cloggers, supplements, different parts of your routine for the very first time in your 20s, 30s, even 40s and 50s.
I get a lot of patients that they come in, they're like, well, I've never had acne before. And I'm like, well, you do now.
Yep.
So let's do something about it. But I second that. I
Yeah.
second that.
The cool part is when you're struggling with acne and you truly make all the steps to clear your skin, can really change your life. And you can develop new healthy habits, new routines, you start paying attention more to ingredients. So, though it can seem a little frustrating and overwhelming when you're in the thick of it, clear skin really changes everything and you end up being so much stronger and just more aware on the other side of it.
Absolutely.
Danielle, same question for you. You own San Diego Acne Clinic, so again, a very different demo and climate than Chicago, where Dr. Omar is. What types of groups do you see struggling with acne the most?
Women and they're between like 24 to 35 for sure. And it's like it's rampant, and it's because of all the products that we're using. It's because of hormonal things that we're going through. Certain types of birth control can actually break people out. Getting off of a birth control
Mhm.
can absolutely make you break out. Certain lifestyle changes, even just taking a new greens powder that happens to have a ton of B12. So any little thing that changes in your life can create acne. And women who are health conscious and they do a lot of things and they are actively trying to do the best for themselves, I find that I relate to that demographic as well. We accidentally do things that backfire on us. Like we'll switch to clean beauty, but clean beauty has nothing to do with acne. Or we'll switch to eating eggs. Like a lot of people are like, no, I'm only going to eat eggs because of the nutrients, and they start eating 3 or 4 eggs a day as their primary protein. I also did that. That can break people out. So basically, the people that are trying to be healthy, oftentimes because this information isn't widely known, it can backfire on them. So I see that as like the commonality that is kind of surprising.
If you could tell yourself one thing in your darkest of acne days, what would that be?
Ooh, something emotionally or a practical tip?
Whatever feels good for you.
Um, hmm. I would say get rid of pore-clogging ingredients. Look here, look here. Yeah, I was trying everything else, but I didn't know to look there, and that is what kept me broken out. Even like right after my last round of Accutane, I started breaking out within the first before 2 months had passed. I remember because it was like near birthday, and it was from my sunscreen. So
Yeah. Dr. Omar, acne is so emotional. I know when I first went in to see Danielle at San Diego Acne Clinic, I was trying to stay so strong and talk about the journey I'd been on. And I just started crying, like uncontrolled, like it just came out uncontrollably. I'm sure you see a lot of patients that are so emotional when they come in for their acne. What do you say to them to help just emotionally support them or keep them encouraged through their journey?
First, I tell them that, they're not alone in this. This affects millions, if not billions, of people. And I tell them if billions and millions of people were able to clear their skin, then we can do it too. I tell them, and I'm pretty stern with them. I have a lot of patients that it is a very traumatic experience, but they tend to not take recommendations or don't want to adhere to a treatment regimen. And I tell them, acne's temporary, scars are forever. So I encourage people to, stay strong, be aggressive, not overdo it. And I just tell them it's gonna take time. I wish I had a magic wand. But things take time, and there's always a brighter light on the other side.
Mm. I agree. There really is light on the other side of
Mhm.
an acne journey. Let's talk about treatments. We get this question a lot. People want to know what treatments should they get, what should they avoid. So let's talk lasers, injections, etc. What have you personally gotten? What do you recommend? What do you like to recommend over other things? Spill it.
Ooh, we are
Spill
going
it.
deep. Okay. What have I personally had done? I've had botulinum toxin, which
What's
is like
that?
Botox.
Oh.
There are different brands. So I've
Okay, so it's kind of like okay, Botox. There's what's that other one that
There's
people get?
Botox,
The
there's
Dysport.
Dysport.
Dysport,
Okay,
there's
so that's another
Xeomin,
brand.
Jeuveau,
Okay.
Latibo. They keep coming out with new ones. I
Okay.
can't keep up.
So why do you
But
like this one, this brand name?
which one
The one you
specifically?
just
That
said
is
you
the
think.
active
Oh, that's the
Oh, that's the
generic.
ingredient.
full
That's
name.
like
Yeah,
the
oh, that's the
Ona
generic.
botulinum toxin.
This
So
is
I
how
don't
much
want to
I know.
mention brand names.
This is why I'm asking that
That's what
Um,
BO
question.
stands for.
but I've been
Got
I'm
it.
I'm like 40 now. I've been getting Botox since I was 25. I
You've
do it
done it
like once or
very
twice a
well.
year. Thank you.
Yeah.
Thank you. I don't like to overdo
Yeah.
anything. I mean, I've had filler. People are like, "Oh, I love your jawline." I'm like, "Well, it came from a syringe, not my mother." So I've had filler in my face. Again, don't overdo it. And I've done chemical peels. I haven't done laser yet because I'm not really great with pain. So I've done chemical peels to help with pigmentation. And I've done like ultrasound tightening,
Yes.
soft wave
I've
specifically.
been so
Favorite,
interested in that.
favorite.
So
Love,
interested
love,
in
love,
it.
love. Everyone should do it once a year as soon as they turn 30, let's
Does
say.
it focus on a certain area or is it all over skin tightening? What does it
So you
do?
can do full face,
Okay.
you can do lower face, which includes sort of like the jowling area, or you can do lower face and neck. You can do full face and neck. What I usually do is like cheek down to this jowl area because I love my parents, don't want to look like them. So we're gonna keep this as tight as we can for as long as we can.
I love that. If someone is coming to you and they are early to mid 30s, what are the first things that you recommend just so they can age really gracefully?
I always start with, do you have any concerns?
Mhm.
Because I've been burned in the past where I'm like, oh, we can do this, we can do this, we can get rid of these lines. And they're like, I like these. So I never judge someone or tell them this is aging you or this is making you look older.
Smart.
So I always ask, do you have any concerns? You can have someone with, fine lines all over, sagging, and they're like, I don't like my pigmentation. Let's focus on that. So I always start with a healthy skincare routine.
Mhm.
And I always would recommend something that boosts collagen. So, like a yearly laser treatment, a yearly soft wave treatment, microneedling, something like that to keep
Mhm.
your collagen nice and healthy. And then we attack specific areas. So, if they have issues with like sagging or they have issues with fine lines, then we'll talk about more specific treatments. But, protect your collagen and
Mhm.
keep it growing. That's my philosophy.
I agree. What are your thoughts on Danielle, all the lasers that exist when people ask you what treatments you've loved the most for your skin and what you'd recommend to people?
Yeah, there's so many different lasers out there. I mean, even an IPL, which is just for brown spots, that's in the laser category as
Mhm.
well. And nearly everyone can tolerate that. Then there's like ablative CO2 lasers. I am not a fan of high heat treatments. They backfire on me every time. They're very expensive, and I feel like the results can be unpredictable for too many people. For some people, it's great. For some people, they're neutral, and other people, it backfired on them. I'm a fan of like a sure thing for everyone every time. I know that's not that realistic and it excludes a lot of things. Um, I really like what is that one laser? It was called the Clear Lift, the Pixel Q switch, where
Mhm.
it doesn't touch the surface of the skin; it kind of goes underneath. Do they still make that laser?
I think so. Yeah, I
Okay,
think so.
I
Yeah.
liked that one. The ones that kind of skip the surface and go
Mhm.
underneath and start simulating collagen from within. I love those. They take there's kind of a gradual effect, but like you can notice it,
Mhm.
especially around the eyes. I really love soft wave.
Mhm.
Ultrasound technology is
Favorite.
phenomenal.
That's most popular in Korea right now. They're all about the ultrasound
It's
Mhm.
technology.
amazing.
Mhm.
Yeah. I started doing that when I was 36 and I do one every year. Yeah. I love microneedling. Microneedling is fantastic. If you haven't done microneedling, if you're considering spending a bunch of money on lasers, I would do microneedling first if you haven't yet, because you'll get a sense of how your skin responds to a high inflammation treatment. You'll see results right away from microneedling. Like you'll see it in texture, fine lines respond really well to it, and because it doesn't use heat, you're less likely to have pigmentation concerns or have it flare your melasma. A
Mhm.
lot of people don't even realize they have dormant melasma just waiting for a trigger. They go do an aggressive laser, and then all of a sudden they have spots that they did not have before, and they're very hard to get rid of. So, as far as other treatments like Morpheus, like radio frequency microneedling, I have personally always felt that it's just too aggressive for one treatment. And I knew I couldn't do it because I have pigmentation concerns. And yeah, I've seen a lot of people have it backfire on them to where I can confidently say that I don't recommend that,
Yeah.
especially for the price.
I agree. I got 3 virtue treatments, which is the, like, less intense version of Morpheus, and you can turn down the heat, but it still has heat, and I think I've regretted a little bit. I think it's fine, and I loved the immediate results from it, but
Yeah, the swelling is great. Everyone
yeah,
thinks they have
it's
great results. It's
amazing.
swelling.
But I really think it caused a little laxity in these areas, in like my jowl areas right
Mm.
here. And so I focus on more skin tightening things right now. And luckily I didn't keep going with a bunch of treatments. I actually purchased a package and I'm just like out that money because I just don't like
Mm.
I don't want to do anymore. But it made me realize that I truly just love microneedling and microneedling with PRP specifically are just so tried and true for my skin. When I first met Danielle when I was struggling with acne, and she got me clear. I was 24 years old, and I really just used our Cell Renew serum to help with my scars for 3 years. I didn't do a single microneedling treatment till I was 27 or 28, and that's where I really just saw amazing results. My scars were already gone from the Cell Renew, and I just wanted improved skin texture overall. Loved the microneedling for that. I love a microcurrent device. You can always get one at home, but there's some professionals that have like the big, really high quality device, and they know how to change all the radio frequencies for different areas of your face, know when to turn up, turn it down. And I actually see incredible lifting and toning results from that from very regular use. And that's my favorite. I've tried Botox 3 times in my life, ranging from like 28 to 33. 2 out of the times I didn't like it. There was like only
Mm,
one time I got it where I liked it. And so now I just focus on all lifting things like
yeah.
muscle release, toning with radio frequency, because I personally don't want to create any muscle laxity. And I do have a bit of a fear from those
Mhm.
2 times where I didn't like the results.
Why did
So
what was
you know what? I get
was it
so
too
tense in
flat?
my eyebrow. Yeah, it was too flat.
Yeah.
There was one time I got it where it lifted and actually helped my eyes a ton because I'm in
Yeah.
front of the screen a lot, and it actually like really relaxed my eyes,
Hmm.
and I really liked the results purely from a functionality standpoint.
Yeah.
But the 2 other times it felt like it dropped it, and I was constantly fidgeting and pushing up my eyebrows for like 6 months, it felt
Yeah.
like. And I really don't know like what went right, what went wrong, and so I'm kind of scared of it.
That I mean, that's the number one issue, the number one thing that we see with Botox,
Mhm.
and we're using Botox generically. This applies to
Yeah.
all the brands.
Yes.
Is yeah, over treatment of the forehead. Like
Mhm.
that's the biggest rookie mistake that you see happening in all the med spas. Is if you do too much, because this muscle here is supposed to lift your brows.
Yeah.
And so you knock it out, your brows are going to drop. So you either do a baby dose or you just skip the forehead altogether.
Yeah, I've never been a fan of what Botox does to me. I don't have a problem with it in general. I just don't like the results. I always feel like it makes me look older. And when the brows right here drop,
That's the biggest thing.
I hate
Yeah.
that. And I feel like I've never been able to really avoid that unless I just have them do a little bit right here. Like they go into my hairline. But
Mhm.
I also just sat in front of the mirror with a little pin needle
Yeah.
and I told a very expressive story and I poked myself every time I made the expression. Guess what? I don't make those expressions anymore.
There you go.
So
Good for you.
I actually don't do anything to relax my skin. I just never raise my forehead.
Good for you.
But one thing I did do that was fantastic is an endoscopic eyebrow lift.
Mm.
I had naturally low brows and I had the lift done right here. It was freaking amazing. 10 out of 10. Yes, it's expensive, but for like the bang for your buck, I think
Well
is
worth
absolutely worth it.
it. Wow.
I heard that's the French technique to do Botox up here.
Mhm.
Do people in the States do that? Because they say it's like the ultimate brow lift without doing like a physical brow lift. Have you
I
seen
don't,
that?
yes, I've
Okay.
seen that. I don't buy it.
You don't like it?
What's,
Okay.
no, I don't think, because all these muscles here, their job is to bring the eyebrows up. How I treat, if someone comes to me and they want a Botox treatment
Mhm.
to maximize brow lift, you do the T-zone area, which is what we call the glabellar complex. So there's a group of like muscles that pull the brow down. So you knock those out,
Mhm.
and then you do a little bit around the eyes that lifts the brow. That is how you maximize
So
brow
just
lift.
total. I feel like a lot of people, to your point, there's a lot of states where there's a lot of people doing Botox that should not be
Hmm.
doing Botox. It
Yeah,
really is an art and a science. You have
truly.
to understand orbital bone, muscle structure. And I do feel like a lot of uneducated people who are administering Botox are like cranking it up here on the forehead.
Yep. And the more they put in, the more they can charge you.
Yeah.
So it's a double-edged
Yeah.
thing.
Yeah.
Before I started San Diego Acne Clinic, when I was new to the industry, I sponged under a ton of places. When I say sponge, I was a sponge just learning everything. So I worked at a traditional facialist, I worked at a med spa, I worked at a different med spa, and then I was just literally learning from everyone. And while I was at the two med spas, granted, every single one of them is different, but we had quotas.
Hmm.
We had quotas, and it was like you have like we had a manager who would say everybody's numbers in front of everyone to
What?
create this like competitive kind of environment, and she would pressure people into so much stuff, and it was
Wow.
just like it was wild, and it was like we're people are coming to us to like we have to view ourselves as like healthcare practitioners
Mhm.
even if we're just doing something cosmetic.
Hmm.
And you specifically have that oath, so it's even stronger for you. But
Yeah.
yeah, it really never sat well with me, especially when I, was in a position of like having to meet a quota. And yeah, luckily my mom came in and
Mhm.
bought a bunch of stuff because I wouldn't have had it. But like it was just
Yeah.
like I remember that feeling, and I'm just like, God, I feel bad for experts and beauty practitioners who have to operate under that direction. But it also just it's not the right thing for the customer.
Yeah.